John Kublank here, and we have an awesome episode of Off the Cuff, all things healthcare. A few little housekeeping. If you like this show and you want to keep watching, you want to be notified, best to just subscribe on LinkedIn or YouTube. Also like this video. Now, my favorite part of every show is I get to introduce my awesome co-host. She is as amazing as the total eclipse is dark, and she is as compassionate as the sun is bright. She has been known to be called the Coach Popovich of nursing. Quote has it, Victor Wembanyama says, and I quote, "I would leave basketball if she would mentor me." Ladies and gentlemen, my favorite guest or co-host, Miss Arlene Maxim. How are you?
Thank you so much. That kind of was over the top, John. I always warn people when they come on as guests that not to be surprised. Thank you so much.
It's
and
simple.
Thank you for everybody who's on today. We have an absolutely incredible session for you today. We're going to be talking about Agile for an entire hour, and this Agile is an industry conference. It's not an Access, although Access is sponsoring it and it's doing all of the arranging, that type of thing. This is actually an industry conference that is unlike anything else that I have ever attended. And I can tell you, in my history of home care for 42 years, I've been to a ton of conferences, and this is the most amazing conference that you're ever going to attend. And I'm not exaggerating. I had people tell me last year that they didn't want to leave. And most folks get kind of conference exhaustion after a couple days and they're ready to go home. People didn't want to leave last year. And so we're back to present another Agile conference. It's going to be even bigger and better than it was last year. We have our enrollment is just climbing every single day. So we're going to have tons of people there. Lots of really great speakers that Mike Carr is going to talk about. But before we get into the whole broadcast today, I want to introduce my three colleagues and very good friends, Clay Hooten, who is in our marketing department at Access, and Deb Hoyt, who works with public policy and is involved in every single public policy in the home care and hospice industry that you can imagine, and works with a lot of our legislators and is very influential in getting policy changes and that type of thing. And then our dear Mike Carr, who is sitting in, some of you probably saw that Christina Andrews was going to be on, but Christina had some other things going on, and Mike Carr has been agreed to sit in, and thank you so much for doing that, Mike. We appreciate you coming in at the last minute. So to get started, I'm going to go ahead and have Clay start and maybe kind of introduce yourself and talk about a little bit about your background, Clay. That'd be great. Thank you.
Sure. Thanks, Arlene. And I certainly, I feel on the spot having to follow Arlene with that intro from John. So I'm kind of feeling self-conscious. But hey, we're all having fun. So thanks, Arlene. Like you said, my name is Clay Hooten. I'm a senior director of marketing here at Access, and my background really, I've spent a fair amount of time in the post-acute space, but really, I'm a marketing creative guy. Throughout my career, I've spent almost all my time in an agency setting. So I've spent a lot of time with creative teams and video teams and brand strategy and all of that. And so to take some of that skill set and bring it here over to Access with the incredible team that we've got has been a real blessing. And I mean, specifically speaking to that, and what we get to do with Agile has been just really fun. To have an idea that is really just something on paper, 2 years ago, and saying, hey, how do we make this a real event? How do we stand this up? What do we have to do to get it there? What's our vision for this conference, this experience? So to be on a team to get to bring that to life, literally from the ground up, has been such a fun experience. So that's just a little sampling of what I get to do, in my daily work here at Access. Great team, great people, and just a lot of fun. So,
and Clay is an absolutely amazing person. I first met him, actually met him at Agile last year, and I didn't realize that what he was doing at the time he was doing. He said, I think you said it was your first time actually doing that function there at Agile, and he was absolutely amazing at doing his job there that he was required to do. So I'm excited to come back and see everybody in just a few weeks now.
I know, and thank you. You're sweet. That kind of back of house job, kind of coordinating, what's happening on stage, the back of the house, the front of the house, and just getting people where they need to go. Very, very fun. But if you can't tell, I am very much an extrovert. So, being back behind a dark stage for 2 days wasn't really tapping into my skill set. So they've got me actually kind of hosting and managing our innovation showcase, which is
nice.
The gathering of all of our sponsors and partners. Plus you get to meet with our staff, go over all of our suite of solutions in a large, big, beautiful ballroom. So that will be super exciting. I'll get to kind of do my people thing, which will be really fun, not behind a dark stage. So thank you for that. You're really kind. And it was just fun, like exploring something that we hadn't ever done before, not just as an organization, and let me just kind of move into my spiel to kind of tee us up. So our vision for Agile was, not to just make a user conference, right? Because those happen. I think those are, an industry relatable event, but we wanted to create something that was way more elevated than that. Something that could really bring some of the best and brightest minds that care at home into one place, talk about challenges that we're all facing, look forward to the future for ways we can make that future brighter and better, and just bring all those minds together. On top of that, let's offer CEUs for everyone who's joining all of our breakout and educational sessions. Let's give everybody an opportunity to do some networking. Let's give everybody an opportunity to have some fun. Let's bring that experience just up, every notch that we could find. And so that is really the kind of vision, the hope, and the goal behind Agile. And again, this is year 2. Our inaugural event was last year, 2023, here in the Dallas area. We had it at the Renaissance Hotel up in the Plano, Frisco area. And so this is year 2. And so we're taking some of that momentum that we had from last year, bringing that into this year, and we are really excited about that. So I wanted to kind of transition here, and I'd love to show a quick video that can kind of help cast, the vision for what we see Agile being, what you can expect if you register and join us. And so, John, whenever you're ready, why don't you roll that video, and I will be quiet.
Welcome to Agile, the first ever Access Growth, Innovation, and Leadership experience.
Always do the right thing. There is a difference between doing things right and doing the right thing. So character is big for us.
This is the most noble work that I can imagine, and I'm very passionate about doing this work alongside all of you every single day.
Agile is amazing. It is. It's incredible. This is a first class all the way.
The future of healthcare is in the home. It's not in a tower in an ICU somewhere in a hospital. People don't want to be there.
I'm having a blast. It has been amazing. We'll definitely be make this part of our yearly calendar for sure.
We really, really appreciate this. And just so you know, this is not an Access conference. It's your conference as much as it's ours. All of it's our conference together.
The party is legit because you know what? Whenever Access do something, people should learn from them. You guys do amazing.
Not only have we had a lot of fun, but we've learned from incredible speakers and experiences like the virtual dementia tour. It was so powerful and impactful.
And I want to thank all of you for joining us and for all that you're doing for our industry. We're doing very important work, because I believe deeply in my heart that the future of healthcare is in the home.
Senior care is very, very important to me, so I know that I will definitely be back next year.
Agile 2023 has been an amazing experience, and it's only the beginning. Can't wait for 2024.
Awesome.
Great. Thank you. So I wanted to share that, for a lot of reasons, but you can really see, what we're trying to accomplish there. So we had a lot of fun. You saw, a few of the folks that are here on this panel with me that were speakers at that event, either on the main stage, on the breakout sessions, Deb and Mike. And so we're going to have many of them all come back and join us this year. We're welcoming back Sarah Madsen Miller, who was the woman who served as our MC. You saw that in the video as well. And so it is just a very energetic, really exciting, but hugely beneficial opportunity for, again, leaders in our field, in our industry, to gather, compare ideas, push things forward. It's just not a place to come and, check a box. So all that said, registration's open. You can kind of see on the bottom there on that scroll bar, it's access.com/agile, and you can get registered today. We also have a hotel block of rooms in the 2 adjacent hotels next to the Irving Convention Center there in the Dallas area. And those blocks expire on April 1st. And so if you wanted to get the best hotel rate, I would certainly encourage you to get in there and do that before those expire. So all that information is on our website as well. So again, we'll hear more about some of the detailed sessions with Deb and Mike, but that was kind of a quick tee up. We're really excited. We would love for you to join us if you haven't registered already. And thanks for letting us, spend some time to educate you about it. So thank you so much.
Clay, can I just ask you, do we still have room for sponsors? I was hoping that perhaps some of the sponsors would be listening here. And do we still have some room?
I'm not leading that effort. Christine is. But the last time I heard, I believe that we do have some open. But I think it's getting very, very close, because we can only support a certain number in the Innovation Showcase. So I could certainly circle back, but I think we might have a little bit of room left.
Okay, thank you. Thank you.
Of course.
Did you have something, John? I'm sorry to interrupt you.
Oh no, that's what I was going to ask, was about sponsors as well. We're on the same playing field. But Clay, thanks for that, and that was a great video. And I know we have another video for the end about about what 2024 is about, which is also awesome. Y'all put on, as Arlene was saying, y'all have a great marketing department. Y'all put out really quality information and material, so it's nice. So Miss Deb, talk to us a little bit. What's going on in policy and legislative? Anything that we should know about? And then what does Agile look like from your perspective, and what are you excited about?
Thank you, John. Thanks, Arlene, for having me on. As always, it's always nice to see all of you on camera, but also the opportunity to speak to the industry and speak to our friends and colleagues about all the good work that's going on at Access and within the home-based care industry. So I'll just introduce myself briefly, give a quick rundown on the public policy landscape, and then jump into Agile and what we call the leadership forum portion of the event, and kind of provide some highlights for that as well. So does that work for you?
Yes, wonderful.
Okay. So I'm Deb Hoyt. I'm Senior Vice President of Public Policy for Access. I've been in the healthcare industry for 35 years, starting on the hospital acute care side, all the way through insurance and managed care, and then most recently the past 15 years in home-based care, home health, hospice, palliative care, and non-medical home care. It's the best place to be. This is certainly the future of healthcare delivery in the United States. People want to be cared for at home, and that's what this conference is all about. Clay, my colleague, did a great job kind of teeing up all of the excitement and all of the, very innovative growth leadership aspects of the conference. And it all emulates from our founder and CEO at Access, John Olajide. You saw the clip of him on stage. He's high energy. He's just a global thinker in terms of where healthcare is going in the home in the future. And we all at Access receive his enthusiasm and his inspiration, and it's all going to be presented and come out at this 2.5-day conference. So we're all very excited about it. In terms of where public policy is going in the home-based care field, everything is changing. Ever since COVID, we see that people don't want to be in hospitals and institutionalized care. They want to be cared for at home. But it's a huge challenge, and Arlene probably has spoken about that. She being a long-term nurse in this industry and also an administrator of a home care agency, there's a lot of challenges around this, and there's a lot of regulation and health policy that we're trying to make our way through. We're working with members of Congress at the highest levels to try to make sure that the providers of home care are reimbursed adequately so that they can hire more staff, so they can care for more people in the home and cut through some of the red tape to make sure people get the care they need. So that kind of plays into some of the things that are going to be going into Agile in terms of our educational content. I mentioned there's a leadership forum aspect, and basically that's going to be a one-day, Monday, April 22nd event. It's an invitation only for the highest leaders in our country that deal in home-based care. Also, those business associates and partners that are aligned with us. Those are kind of the investors, the private equity folks. Those are the think tank people, such as Dr. Richard Frank, who's going to be our keynote speaker from the Brookings Institute. You know, we're really bringing high-level thinking, and we're bringing, you know, the economics and business aspects of home-based care to this leadership forum so that we can have, you know, the brightest minds throughout the industry, the CEO level, C-suite level, who are running these very large enterprise organizations so that they can see where they need to go in the future, how they need to adjust to this value-based care, to what the Medicare Advantage companies are wanting out of them. We definitely have the solution as home-based care providers. We just need to all work together. So this conference, Agile, is all about bringing people together to think through big ideas, to innovate, and to come away with some really good new thinking that we can put on paper and actually, you know, go to Washington with so that we can create some real value for the people that receive home-based care. So Arlene, I'll just take a minute to highlight some of the aspects of the leadership. Does that work?
Yes, great. Yeah.
Right.
Let me ask you this. Do we have any more room for people to register for the leadership session?
Good question. We have about 50 people registered now. It's invitation only. And we do want, you know, up to 75, maybe 100 people at the most. But we only want, you know, the C-suite folks that can really roll up their sleeves and make this a working session for them. So thanks for the question. We also have some really good sponsors for the Leadership Forum, and we're really grateful to them for their support as well. So we are going to start with an evening reception and a Leadership Forum dinner on Sunday, April 21st. That's kind of the first day when people are getting into the hotel and registering. It's going to be very high energy. But Monday, April 22nd, and Mike will get into this, is the actual start of the Agile conference. There will be, you know, opening remarks by John Olajide. Our keynote speaker at the general session will speak. And then earlier, mid-morning, we'll break out so that the leaders are going to go into a separate conference room to have their leadership forum. And we'll be hearing about the economic and budgetary context of Medicare solvency and the future of Medicare Advantage policymaking. That sounds very wonky, but it is. We need to hear from Dr. Richard Frank and learn from him in terms of where the future is going, in terms of the publicly funded programs like Medicare and Medicaid and how that's going to work into home-based care's future. And then we'll be having a very energetic luncheon speaker, Tony Geary. We'll talk about, you know, business strategies so that business organizations get results faster. And then following that, we'll have two panels. John Olajide will be moderating the first panel, which is called Industry Deal-Making Challenges and Opportunities, Valuations, Growth, Merger and Acquisition. And, you know, that's the business aspect of what's going on in the largest organizations of home health and hospice around the country. But we shouldn't really be afraid of that as much as know that that's where these large organizations are in terms of thinking about aligning with, insurance companies and the managed Medicare Advantage plans to really take care of people. And Arlene knows this as a nurse, as the whole person, and really make sure that we're managing populations, because that's going to be the success that we have as a nation to kind of getting a handle on a lot of this chronic disease that we're seeing, particularly in home-based care settings. So talking about what the future is in terms of many of our provider organizations and agencies. Are they going to merge? Are they going to grow? Are they going to consolidate? We need to make sure that there's adequate coverage in every single state so that there's enough providers to take care of the people that are going to be needing this care, not just this year or the next 5 years, but in the next 25 years, because this is really where healthcare is moving. So that's going to be a very exciting panel. And then the final panel of the day, I'm just looking at my notes here, is a panel that I'm actually moderating called Public Policy, Politics, Predictions, and Disruptors for Home-Based Care. And I'm very excited about this. I have 4 of my industry colleagues that are going to be on the panel. Andrew Woods, he's the chairman of Liberty Partners Group. He is our #1 lobbyist in Washington, D.C., representing all of our national associations. And he'll bring great kind of inside the Beltway insight into, what's happening on the policy side that's going to make all of our work very challenging but exciting. And then we have leaders from Amedisys, Vitas, and Gentiva, 3 of the largest providers in the nation. They're government relations leads, and they are fabulous people going to be offering fabulous information and insight. So this is just the leadership forum segment of Agile, and I just wanted to provide some highlights on that. But I know that Mike Carr will talk about the general sessions, the breakouts, and the other pieces that are going to be very valuable for the clinicians, the operational folks, and the other people that work on the technology aspect. So that's it for me. Do you have any questions, Arlene, or anything I didn't cover?
Now, are you speaking yourself at Agile, or other than the moderation, are you going to be speaking at all?
No, I'm just going to be moderating this panel, and then I'll also be facilitating our industry advisory board meeting that we're having too.
And then the other question I had is, what policy influencers will be at Agile itself, at the conference itself, and do you know what they'll be speaking to? Do you have that information with you? We don't have any legislators that are going to be speaking. Intentionally, we don't invite kind of members of Congress to speak because we want to be able to speak kind of inside, as a family, as an industry. Right. But Dr. Richard Frank, he is a former government official and lead on the inside from CMS. So he will bring some inside information now that he's with the Brookings Institute, which is really kind of a think tank. For everything health policy. So he's going to be very dynamic. Yeah. Bill Dombey's there, right? He
will be attending. Yes. We'll be having several different association executive leaders attending just as conference attendees.
We also have some state association representation this time that we did not have last time. And that's really exciting that we have state representatives coming from the state home care and hospice associations.
Yes, thank you for mentioning that. We're really happy to have our state association execs. They're very important to us, and they do the on-the-ground lobbying and advocacy at their state capitals, and that rolls all up to our federal work too. So yes, thank you for mentioning that.
Sure. Yeah. Okay. Good.
Mr. Mike, talk to us. Tell us a little bit about yourself, and really let's start digging into some of these panels. I know there's a couple that I have some questions about, so I'm excited.
Okay. Excellent. Well, thank you, John and Arlene, for inviting me to join you, and hope I'm a worthy substitute for Christina. So,
we can tell you that's ready.
Well, first of all, just to kind of circle back to a couple of things that Arlene and Clay and Deb maybe touched on. I'm not sure if any of us have mentioned yet, Agile actually is an acronym that stands for the Access, Growth, Innovation, and Leadership Experience, which is kind of a mouthful, but it really speaks, I think, very well to what we're really trying to do, and what we did well last year and what we'll do even better this year is really not just be another conference. We've all been to 100 conferences. They all serve a great role. They accomplish their kind of vision and mission, but ours is just different. And I think you guys use some great words in there of, innovation and just change and different and elevated. And I kind of, as I was looking through some of the content getting ready for this, those are some of the words that stood out to me. Certainly technology and AI, and certainly high energy. Can't leave behind things like compliance and such that are kind of key to what we do. But I think it's really just a different experience than what we typically go through, and you feel that from the moment you walk in the door. From the vibrant colors to the upbeat energy that the presenters and the staff and everybody else has. It's just totally different vibe than.
Well, that's funny that you said that, because in one of the meetings that we had at Access, I mentioned that the only thing that I can think of that I've been included in my lifetime was when I went to Las Vegas to a New Year's Eve party, and coming down the escalator and how they had everything decorated and the excitement. That's the only thing I can compare to Agile. And unless you go to Agile, you're not going to understand what I'm talking about, because it was one of the most exciting things I had ever attended. And I had to do some work there too, and I was still excited about it. So I'm glad you said that, because it's more than a conference. It's an excitement. It leaves you walk away from it just thinking what else could possibly happen next year that Agile or that Access could make this even better than it. And I know it will be. I know 2025 is going to be more exciting than 2024. So thank you for saying that, Mike.
Yeah, you're welcome. When I've had a chance to talk to people since Agile 23, I tell them the only thing that Access does better than software is conferences. and maybe parties and food and just the whole environment, because it really was a lot of fun. It was a lot of work, but it felt like it was valuable work, because I think people left there really enriched with the connections that they made with vendors, with other people in the industry. Certainly the knowledge takeaways from the sessions, it all had meaning and purpose behind it. So there's not any wasted time there. Everything is designed with a purpose of being able to socialize or interact with other people in the industry. But let me quit babbling about all that and kind of get to the meat of what we're doing there. So certainly, I think I'll defer to Clay in a moment to speak about our keynote speaker, who he's had a chance to spend a little bit of time with. But so that's certainly going to be the highlight you saw in the video. Last year we had Cint Marshall from the Mavericks, who was just absolutely amazing. To have 75 people up on the stage dancing with her by the end of the session was, again, you're not going to get that at the State Association show here in Maine. So no offense to the folks in Maine, but it's just different. This year Nick Webb will do something different, but something probably very memorable that we'll be talking about this time next year. So that's going to be one of the highlights. But then we'll kind of go from there into to general sessions, where again everyone will kind of be in the same spot. One of those, the first one of those is titled "Embracing Risk to Reimagine Healthcare." So again, even just I think the names of our sessions are distinct and purposeful. So that's going to be a great session. That's going to be again a panel discussion. Brent Corte from Front Point Health, who's again a very well-known person in industry. Kim King, who's the CEO of Home Care Network. A very impressive gentleman, Dr. Harry Sag, who's the National Medical Director of Walgreens Health, and a good friend of his, Dr. Cameron Berg, who's the Executive Vice President of Clinical Strategy at Pearl Health. So again, those aren't people you're going to run into at many conferences, and that's just that's one example of a breakout session. A general session that will be followed by a series of breakout sessions, kind of along the same mindset, but now breaking it into those pathways where we'll have something special for home health, which will be different than home care and hospice, and a financial track, so people can pick and choose and kind of build their agenda a la carte of whatever kind of suits their needs. That will be followed by another general session Tuesday morning, and that's entitled Building a Sustainable Nursing Workforce. And again, not too many things more important in our industry right now than our our workforce, or workforce shortages, or poor allocation of workers, or however we want to look at that. Super excited that Marcel Combs from Mac Legacy, who's again perhaps one of the nicest people you'll ever meet, but also kind of a luminary in the home health industry or home care industry. She'll be moderating that panel with a lady named Marcia Proto from Connecticut, the Connecticut Center for Nursing Workforce. She's the executive director there. Kayla Davis, who's a research specialist at the Texas Center for Nursing Workforce Studies. Clark Ruttinger, who's a MBA, who's the director of Health Workforce Consulting and Life Sciences, and Kathy Driscoll, who's the Chief Nursing Officer at Humana. So again, really well curated panel of people, I think, that have been brought together. This Christina and Ryan Klostermeyer from our team have really started the day after Agile 23 ended to really put together the right speakers. We sought out these people purposefully to have them come and add their thoughts to what we're trying to get accomplished at Agile, to really innovate and lead and disrupt the way that people have been thinking, because Arlene, I think, is one of the people that made the point that if we keep doing things the same way that we have for the last 25 or 35 years, we're going to fail. We need to do things differently. We need to leverage technology and learning and all of our opportunities to move forward as an industry to really stay viable and stay important. Because like one of you guys said a few minutes ago, that's where people want to be taken care of. They want to be taken care of at home. So.
And I think what's really exciting too is we're seeing, and you just went over some names that most people in the post-acute care world have not even heard of. They have not attended conferences where these folks have spoken. Many times you go to conferences and the same people over and over again. I'm probably one of those that are included in that list, but you figure you're going to hear the same thing from that person over and over again. So I think it's just really important that we were able to pull together the types of speakers, and like you said, the quality. I mean, we're going to learn about things that most conferences in the post-acute care world don't even talk about, like neuroplasticity. Who in the post-acute care world had thought about even neuroplasticity? But that's a really, really important thing to be aware of if we want to improve our outcomes. And how can we do that? And we're going to have tips on how to do those types of care improvements with our patients. So I think the quality of the folks that have been pulled together for Agile is just really, really impressive.
Well, and I think the one thing that I'm seeing, what I love about Access too, is with the innovator showcase and pushing the innovation. I joke, but it's not a joke, often that home care is 10 or 15 years behind the curve on most technology, from your grocery store to wherever. We're very scared to jump in and Access. If you ask these operators, these owners, what kind of sessions you would have, they would have asked you for another horse. But y'all are giving them the car, right? And they just don't know it yet. And they don't even know all that's available. And there needs to be a hub where people can go and not only get the information, but trust that it's good. So as an administrator myself, depending on which role or where I was at, you'll get, every day 15 different new technologies are trying to come in, but I don't have time to vet every single one. I don't know if they work, if I can trust them. So Agile to me also seems like a built-in credibility to help me kind of get through that initial, scared, but then I can actually see what they're trying to show me.
Yeah, I think that's a great point. And one of the other general sessions we have is again going to be led by our team, Andrew Olahu, I can't say his last name. I'm sure he'll forgive me. Who really is probably our brightest mind as far as innovation and technology. And that's entitled Innovation Domination, a deep dive into technology's role in the care at home industry. So that's very much what you're saying, John, is those are the people that we want to hear from, of
Yes.
what works, what's there now, but more importantly, or as importantly, what's coming next. What do we need to be thinking about? That's, the next evolution of where we're all headed. And then the fourth general session, is standing up to the scrutiny of auditors, payers, and politicians. So again, another great name, I think, that really pulls together everything that we need to be thinking about as industry, because it's not just about, the auditors and the surveyors. It's really what's coming next for the public policy and for leadership looking at care at home too. So it's positioning the attendees will be well positioned for success, because we're moving certainly much more towards a value-based world, whether that's home health or hospice or home care. So we need to understand that. We need to be mindful of the financial implications of everything that we do. So I think that will be the attendees will certainly be well served by the time and energy that they put into attending. As you're talking a couple of times, John, about the innovation showcase and getting kind of back to your analogy at the beginning about the eclipse that's coming along here pretty soon. Last year that was a nice experience. This year it will be even better. But I kind of think of that as kind of Access being the hub or the sun, and then all of the sponsors and partners, whether they're interoperability partners or channel partners. But again, people that we've vetted and we know provide value, kind of be the constellation around that sun. So it's kind of makes our own little ecosystem.
Well, and it's, again, there's a process. Y'all are wanting to find the best products, the best technology, the best for these operators, so that they can take their business, and it's a win-win for everybody. Because ultimately, Access being a great EMR, the more patients they have is better for everybody, right? So I think it's a very nice working relationship, because everybody really does want to push you up, but y'all really try to take it to that next level by serving up stuff that nobody has seen. Ms. Zandra Ellis, which we love, has a question: what home care roles will benefit from Agile? We can open this up for the whole panel, not just Mike, even though Mike, you're more than welcome to answer.
Well, I'd just start by saying thank you for the question, Zandra. And I think there's really going to be something for everybody. There was last year, and there'll be more of that this year, whether you're a hands-on care provider, a nurse like Arlene, or a therapist like myself. There'll be clinical skills to take away, not only from the presentations and the CEUs that will be earned, but also just from the interactions with the sponsors and the other attendees. But there's really, whether you're in billing or whether you're in finance or whether you're in kind of agency operations, I think there'll really be a takeaway, or many takeaways for everybody, regardless of why you're at Agile. They'll be meaningful and beneficial.
Wonderful.
And I think too, we need to realize this is not a user conference. This is not an Access user conference. This is for everybody. Yeah. So if you're on whatever EMR you're on, you are welcome with open arms to come to Agile. You are going to learn something that's going to be very valuable, that's going to help you just in your working for your day-to-day activities with your patients and your clinicians. You're going to get something out of it. It's not meant to be a user conference at all. It's there for the industry. And I just think we need to make that clear, because many times people think, well, I don't use Access, so I don't need to come. But you're going to get something out of it. I promise you. It's going to be a great time. Anything from you, Clay or Deb? Did you want to weigh in on Zandra's question?
Sure, I would love to, and you both have answered it so well, but I think that the caliber of the speakers at the general session, they definitely will cover a broad range of aspects of all of the different roles that make up home-based care. I mean, we need such a diverse group of individuals, not just, leaders, not just, high-level nurses and clinicians, therapists, but really people that run the full operations, the back room, workings of, the software and all of the different things that, scheduling and billing and payments and all of that. So I think that it's really there will be something for everyone. The one thing that I did want to mention too, that kind of ties into the innovation showcase, is that all of those showcase partners, vendors, are really business partners of Access. And basically it helps us when we look at our Access ecosystem, all of the different technology providers in the country, in the world, that have to come together to make this work. It's really quite exciting. And we see some of them not just talk about their interface with the Access technology, but also they have their own different products that they're deploying now, innovative tools that they're deploying in the home that I think, all of the attendees will be really excited to look at. I mean, the future is on your handheld device now. I mean, all of the different things that we're able to do and all of these, different technology vendors are showing us. I always get very excited about seeing all of the different things that are happening. So it really is, quite an engaging event on a lot of levels. Access always throws great parties and there's social events and meals and networking and, so a lot of that happens kind of in the hallway, outside of the ballroom, outside of the classroom. A lot of that is really good conversation that actually connects people in a deeper way to make this industry better. So thank you for all the work you've put into it, and Clay too, for making this so exciting.
Yeah. John, I'll add really quickly, because, and Mike, you kind of teed it up. If you were just to take Nick Webb, so, I mean, he is a, world-renowned, innovation speaker. I mean, he's a futurist, a researcher, a management consultant, an author, really, really dynamic guy. If you were just to take him, it would probably be worth it, but he's not the only one. So if you were to look at the consultants, the leaders, the thought leaders, again, all the people that are in those upper ranks, if you were to break out what it would cost you to go sit and spend 35, 45 minutes with these leaders, man, you've already paid for your ticket cost to come to Agile. So just the caliber and quality and the breadth of the thought leadership present, again, at least from our perspective, feels worth it, right? Especially when things are moving as quickly as they are. And John, you mentioned it too, like there is that feeling that this industry can be a little bit slower to catch on. So that, again, it just drives the point why these conversations need to happen, that these gatherings need to happen, that it kind of helps push it in the direction that it needs to go. So again, really excited about the faculty, about the thought leadership there. It's going to be fantastic.
Yes.
I'm very excited about the AI panel. I know that machine learning and artificial intelligence are a huge topic throughout the country. I don't know what y'all have as far as an opinion on it, but how important is AI and machine learning really going to be for the future of healthcare in y'all's opinion?
Yeah, I'll jump in because no one else did. So I certainly, you're right. That's the way. We're not going to have more people to provide care, so we need to innovate and learn a different way to do it, and that needs to be technology based. The technology that we have has to get smarter, whether that's the EMR or whether it's whatever adjunct to the EMR. That needs to continue to improve, but every day there's new things that are being introduced to the industry, whether it's to improve safety or whether it's to improve outcomes or whether it's to improve whatever efficiency along the way. That's going to be the only way to survive as we move forward, because there's not going to be a bunch more nurses that are going to graduate from colleges or therapists that graduate from colleges or people who want to become PCAs. We'll never be able to get away from them, but we can't be naive enough to think that we're ever going to have a surplus of them in the foreseeable future. So I think we need to work smarter, not work harder, right? So that's the only way to do that, is to embrace the smart people out there that are innovating and changing the way that we can train people or onboard people or automate skills that people are doing now. So I definitely think that's what we have to wrap our arms around.
Yeah, and Arlene and I use ChatGPT quite often for a various number of things, but in these sort of type of panels, I'm hoping, and I'm sure that they will, about the broad application, because we are afraid of this term called AI for the most part, because we hear it in the news, and it's a very large term. What does it mean? Or machine learning, what does it mean? But then when you break it down to specifics about, ways that we can utilize it for data, great. But then there's just ways from an operator's perspective that you could utilize these things to, again, like you said, that we don't have more time, we don't have more labor. So I need to make this faster and I need to make it just as good or better than however I did it the old way. So I'm very excited about, that specifically. But
there are sessions included at Agile on AI, so that is included in the plan. Yeah.
Very exciting. Very exciting.
Yeah.
So before we end this, I wanted to make sure we show our last video. Did y'all have anything else to cover for access or topics you wanted to hit?
We certainly, I mentioned the general sessions. Certainly those are all going to be followed by breakout sessions. Each session will, again, be worthy of CEUs. We'll be granting CEUs for each of those 90-minute sessions. And again, it's kind of, I think, not to, again, put down any of the general conferences that we go to, but I think the people that maybe are keynote speakers at those conferences are now in our breakout sessions, and people who are kind of regular presenters at some of those conferences that Arlene and I speak at, or maybe now panelists at some of these sessions. So it's just, there's more volume and more quality of content being offered. I think we're still going to hear from a lot of voices. I think there's 65 different speakers or presenters or panelists. So just lots of different perspective, which I think is valuable and important. But, not to leave out any names, but John McGuire is the person that Arlene alluded to, who's kind of a leading researcher on this neuroplasticity, kind of how can that help us treat dementia patients, for example, or improve the lives of dementia patients and their families. Arlene's not to be belittled by any means, that she'll be presenting with John, but people from Symmetry and from Mac Legacy and from Inhabit and literally all over the world, Beata, just the best and the brightest are really being brought together to help us all learn and help the industry be better.
That's wonderful. Deb or Clay, do y'all have any final thoughts?
Last thing I'll say, and I'm glad that they brought up again that element, that side of it. But I'll mention again, this is a really fun event. It's taking place at the Irving Convention Center, and really right next to the Irving Convention Center is this really electric area with music and dining and entertainment. It's all walkable. Our two main hotels are right there across the street. So it's going to be a really fun event. Again, April in Dallas, normally really great weather. So that's the last thing I'll say. It is definitely fun, beneficial, impactful, useful, but also fun. So come join us.
Awesome.
Yeah.
And John, just one last thing for me. I would say that, if anybody has known Access as a company over its kind of young 20-year history, it's a young, innovative company. Access has always been about engaging and bringing together the industry, and normally around education and innovation. So I think Agile as a conference, it's not even a conference, it's an event, it's an experience. I think that it's really something that has kind of brought together everything that Access has always done and really made it a wonderful opportunity for people to, spend time together in a really creative space. So, I'm very excited about it. I was there last year, and very excited about all the creative things that Clay and his team are going to be bringing to us this year.
Awesome. Well, let's take a look at this promo video real quick for the 2024.
Agile 2023 was a lot of fun. We ultimately networked with so many different vendors.
It was a place where people in the industry can come together for information exchange.
We got to meet many of the people that are behind the scenes, meet them face to face, and it was an incredible experience.
We met with a lot of Access members and just got a better understanding of what's coming.
It's allowed us to learn different problems and solutions within our healthcare industry.
Love the networking, love the discussions about AI.
Agile created an environment that we not only learned, but we had fun, and that we will definitely be back.
I'm definitely looking forward to going to the next one in 2024.
Awesome. Well, thank you, everybody. Thanks to our amazing panel for coming on today, talking to us about Agile 2024. Arlene, as always, thank you for gracing us with your
Thank you, John.
amazing talents. Guys, please always subscribe, like, share this video with your friends and family, especially colleagues who are interested in healthcare. We try to make sure that we have relevant content that is good for you to know and to stay on top of. But that is all we have for today. So until next week, we will see you then. Thanks, everybody.
See ya.
Thanks.
Thank you.
Thank you.
Thank you.